Targeted anticoagulant. Anti-anticoagulant. Anticoagulant treatment with vitamin K antagonist is very complex. The new direct thromboid inhibitor and factor X can be administered at 5x dose and require no systematic monitoring or dose adjustments to ensure its effectiveness and safety. Cause they have been completed with positive results several past trials for prophylaxis and venous thrombolysis and orthopedic surgery, VTA treatment, or prevention of stroke in patients with atrial fibrillation. Exam. Since the available laboratory tests are inaccurate and not the degree of anticoagulant is unknown, and also vary according to the interval between doses. Consider drug interaction and the state of renal function.
Number 4. Non-vitamin K antagonists as oral anticoagulants.
Blood clotting or coagulation is an important process that prevents excessive bleeding when a blood vessel is injured. Deep vein thrombosis, or DVT, is an example of an abnormal blood clot that forms in a major vein of the leg. When these clots break off from the vein, they can travel to the lung, causing pulmonary embolism. Collectively known as VTE, venous thromboembolism, this serious and life-threatening condition affects more than 1 million Americans each year. Oral anticoagulant therapies have been used as a preventive measure against the formation of these dangerous blood clots. Problems with unpredictable effects, the need for close monitoring, as well as food and drug interactions have made these current methods of therapy difficult to manage, prompting researchers to look for alternatives. Promising results in the development and testing of 2 new non-vitamin K antagonists as oral anticoagulants present more convenient treatments for patients.
New anticoagulants. The 4 new anticoagulants with more advanced clinical development are dabigatran, rivaroxaban, apixaban, and exobane. In fact, the clinical development of new anticoagulants has focused on the prevention and treatment of venous thromboembolism, prevention of stroke and embolism.
The newer agents, what we call the novel oral anticoagulants, really represent a terrific breakthrough. And so people don't have to get their blood checked, which is wonderful. Now, on the extremes, so a patient who's very, very thin, probably their levels are going to be too high. Ditto, a patient who's very, very heavy, probably their levels are going to be too high. Patients who are elderly, they probably are going to have more problems than patients who aren't. Patients who have kidney dysfunction, probably we're not going to be so accurate. All of that said, taking into account all the caveats, the beauty of the newer agents is the decrease in bleeding in the head. So
go ahead and subscribe to our channel. But the best stuff really happens on our website, diagnosticdetective.com. After you subscribe here, visit our site and leave your email so you see full versions of our interviews and more. But do subscribe to our channel. Thank you. Hit that subscribe button now.
Conclusion. It's very important to encourage patient adherence, particular trauma-specific education as anticoagulant patient, because regardless of the prescribed anticoagulant, there are risks and precautions common to all patients receiving anticoagulant.
see factor 10A inhibitors, or when you put it together, have a lot of times like B, you can see the acronym for the four are BEAR. So the first, the B is for trixaban, the E is for edoxaban, and so on. So the creators of these drugs helps us to remember by putting the XA in, which is 10A. So when you see drugs like Saban with the XA in there, they are factor 10A inhibitors. So easy to remember. That leaves the last one to be the bigatron. It is a direct thrombin antagonist. There's no clever, witty way to remember this, but use this one. It's poorly made. So D for direct, and TR is for thrombin, HR and antagonist, the bigatron. That's pretty much it.